Foreign nationals are being blocked from accessing public healthcare services in parts of South Africa. Groups like Operation Dudula have been stopping migrants from entering clinics, especially in Gauteng as well as KwaZulu-Natal. The government and the South African Human Rights Commission have condemned these actions, calling them unlawful and warning that healthcare is a constitutional right for everyone, regardless of their nationality. While just yesterday, Operation Dudula blocked the Goba Primary Healthcare Clinic in Katlehong. The group says that only South African citizens are allowed in and foreign nationals are asked to seek paid-for services in private healthcare. ActionSA Member of Parliament and member of the Health Portfolio Committee, Dr Kgosi Letlape, says that illegal foreign nationals should be removed from public hospitals, and he joins us now for more on this. A very good morning to you, Dr Letlape. Thank you so much for making time for us this morning. What's your response to seeing organizations such as Operation Dudula? We also have other people calling themselves March in March or March and March that are blocking foreign nationals from accessing public health care.
We need to ensure that we uphold the rule of law and the authorities, the relevant authorities, do their job. As a medical practitioner, no one should be denied access to care. But as a nation, we should ensure that there's differentiation to what accrues to citizens and what accrues to visitors. Visitors must have health insurance so that they can access the public healthcare system. As you've mentioned earlier on, the Constitution talks about everyone, and it needs to be corrected that their rights to citizens, the right to health care, should be to citizens. No one can be refused emergency treatment, and that will go to anyone. And what should be happening is that when people get into the facilities, the officials should do their job. If people are foreigners or undocumented, after they have been attended to, the authorities need to be alerted, and they should be handed over to the immigration services. Those are the laws of the country. If everybody did what they're supposed to do lawfully, you wouldn't have citizens taking the law into their own hands. So it's quite rich when the Human Rights Commission doesn't talk to authorities that don't do their job. And when you have vigilantism, they then stand up. You see in townships, when police don't respond to criminality, that the communities take the law into their own hands with disastrous consequences. We need to ensure that Home Affairs, immigration officers do their job properly. And officials at healthcare institutions alert the authorities to people that are there unlawfully. And we are not suggesting that people should be denied treatment. If South Africa wants to be open to all 8 billion citizens of this globe, they must make sure that they make proper financial provisions for that. That is why I call for parliamentarians like myself to use the public healthcare system so that we should feel the pain that we cause ordinary citizens. Health in this country is underfunded, even just for citizens themselves. So when you open the doors to everyone, it's chaos and it's hypocrisy. When me and members of the Human Rights Commission go to private facilities that are underutilized, and that is where foreign nationals should be taken to. And the state should pay for them in those facilities. If that is the state's attitude, that they will treat any of the 8 billion citizens of this planet.
Yeah. You mentioned earlier on having health insurance. Now, considering that some of this category of migrants that we are speaking about here are not necessarily tourists, but these are economic migrants, how do we deal with that aspect around health insurance?
Or how you deal with that is that whoever employs them must provide them with health insurance. Medical aid or any other form of health insurance is offered to people that travel. And that is what should be enforced. You know, this internationalism where we playing goody two-shoes to the world at the expense of our citizens is not acceptable.
Yeah, but they would be undocumented, Dr. Letlape. And whoever employs them sometimes don't even declare that I've employed somebody undocumented.
But that's the point, the rule of law.
Yeah,
That employer should be taken to task for employing undocumented immigrants when we have lots of documented South Africans. We have 40+% youth unemployment. And we cannot continue rewarding unlawful conduct, whether it is from employees, whether it's from people that cross our borders without respecting our entity and come in illegally, whether it's officials in health facilities that don't do their job in accordance to the laws of this country. We have to stop rewarding unlawful conduct.
Yeah. Do you think, Dr. Letlape, that perhaps maybe the problem could also be in South Africa's, and this is of course informed by the ANC, which used to be the sole governing party at the time, South Africa's foreign policy when it comes to undocumented foreign nationals or refugees, that South Africa's foreign policy has decided that we don't want refugee camps. Instead, what we want is to integrate refugees into our communities, and then you have this battle for limited resources. Instead of having a camp where you know that these are the number of people that you are dealing with, and therefore you'd be able to budget for those people, including getting resources from other organizations outside of South Africa.
So you want to turn our communities into refugee camps. And then we complain when there's lawlessness, when you have GBV and F, when you have young women being raped in a mine dump, and then we complain because we have this policy that is unimplementable. So you have a foreign policy that makes your country ungovernable. Then we need a new government. That policy doesn't work. And I'll be frank even to say that this notion of the Freedom Charter, that this country belongs to all who live in it, was meant to talk about citizens that were deprived of their rights. It was not meant that this country belongs to the whole world. We have to make citizens recount. In the past, we were not considered citizens of this country. Now, we are being marginalized by policies that are not funded, that are not implementable.
As the founder of the African Medical Association, would this have been something that was on your purview around how do we deal with the pressure that is placed on sovereign countries like South Africa by migrants on the health system of that particular country?
Our purview in the African Medical Association was to ensure that medical associations advocate for working systems for their own citizens, so that people should not be migrating for healthcare. We need to ensure that the government changes its policy of protecting governments that can't protect their own citizens. Remember, not so long ago, where Robert Mugabe lost the election to Mr. Tsvangirai, and it is alleged that South Africa helped him steal the election. We need a government that doesn't go into, embracing fellow freedom fighters, but upholds human rights and ensures that people in their own country respect their own citizens. So that as a continent, we work to governments that work and serve the people, so that we have a continent that can flourish.
Yeah, and those very same countries that you're speaking about, to assist those countries to have their internal systems to be able to respond to the needs of their citizenry, seems to be very low. But then at the same time, those very countries, their own presidents seek medical attention outside of their own countries. So meaning that the first citizens too don't have confidence in their own systems.
Well, that's no different from South Africa. We, as public officials, seek healthcare outside our public healthcare system. The fact that we've been fortunate to create a private healthcare system and a system apart from the ordinary citizens, and the others have been so negligent that they go to travel outside their own countries for care, does not make us any better. As long as we do not share in those public services, that we create policies and open borders so that they are overcrowded, that they are underfunded, and they cannot provide quality health care as promised by Section 27 of the Constitution. We're just as guilty as those outside. That is why I propose to Parliament that as parliamentarians, we should use the public health care services for our own care, because we're no different from those that fly to London.
Yeah, and just in conclusion, Dr. Letlape, you are not saying to medical practitioners that they shouldn't adhere to their Hippocratic oath?
No, we are not saying medical practitioners should not submit to the oath. If you are a healthcare practitioner and a patient has gone through administrations, through the gates, and is in front of you, when a patient is in front of you, you do your job.